Welcome to Reach Out, the program that highlights the amazing work carried out by local nonprofits, the wonderful people who lead these organizations, and the committed volunteers who give of themselves but wind up receiving even more. I'm Bernadette Wagner, Director of Volunteer Washington County, and my guest today is Kay Hoffman, Director of Development for Brook Lane Health Services. Brook Lane strives to help children and adults improve their emotional and behavioral well-being through education and treatment. I'm pleased Kay is joining us today. She will tell us a little bit about Brook Lane's history, the services it provides, and the challenge it is facing as it strives to meet the needs of our community. Tell us a little bit about the history of Brook Lane.
Well, Brook Lane has been around since 1949. We actually were started by the Mennonite community and started off as a adult hospital for people with emotional and behavioral challenges. Today we have 43 beds, and we actually serve children, adolescents, and adults. And are the only hospital in the area that takes care of children and adolescents.
Okay, and I know you have a wide variety of services from daycare programs and inpatient. Can you tell us a little bit about them?
Absolutely. Of course, our main care is for inpatient, and that's on our campus located near Leidensburg and Smithsburg. We also have outpatient services and partial hospitalization program. Partial hospitalization programs for a patient who's not acute enough to be in the hospital but needs a full day's service.
Okay.
And we have partial for children, adolescents, and adults. We have that program here in Washington County as well as in Frederick County. And then we have specialized program for children and adolescents in our school, Laurel Hall School. Laurel Hall School is for children with behavioral, emotional issues. They come to us through the Board of Education, and we take care of their academics as well as their therapeutic needs.
And you also have some programs, outpatient programs out in the community, is that correct?
Yes, we do. We have an outpatient office off of Longmeadow Road at North Village, as well as in Frederick.
Okay. And I know that you have some pressing problems at Brook Lane that you're striving to address.
Yeah, we do. As I mentioned, Brook Lane is the only hospital that cares for children and adolescents in an inpatient setting. This past fiscal year that just ended in June, we actually turned away 732 children and adolescents because we did not have a bed.
They needed the care but couldn't get the treatment.
Exactly, exactly. And what happens to those children is alarming because most of our referrals will come through the emergency room. So that child will go to the emergency room, they do an evaluation, find that that child needs to be as an inpatient and be hospitalized. They call us, we don't have a room, so they'll either stay in the emergency room until we have a bed, or they'll travel over an hour, or they just don't get care. And that's the piece that's very frightening, is that they don't get care.
How can the public help with that?
Well, we have just launched a capital campaign to expand our hospital. And
can I hold this for you?
Yes, you can. We even have it right side up. Just to show our new hospital, we're going to be adding 14 beds for children. They'll all be single occupancy rooms. Then we're also going to have a second floor which will house all of our doctors. How people can help, they can call me and learn about our programs, and love to have the opportunity to talk to any organization that would listen to me. They can volunteer. We're looking for opportunities for some special events and for committees to help us raise money. One of the keys right now is that through the state of Maryland, we've received a $1.1 million grant, but that 1.1 needs to be matched dollar for dollar in order for us to get that.
So people who are interested in supporting the youth of our community, their emotional needs, could contact you. I believe you have it listed on VWC's website as well.
Yes, absolutely.
And so that's another avenue for them to get involved, a way to get in contact with you.
Absolutely,
That's
absolutely.
great. Can you tell us right now some of the fundraising opportunities that you have in place for this?
Well, we actually have a foundation that we have put together, and so we have a group of volunteers, and this group of volunteers is out working really hard to find donors. So we're just building committees of people who are interested in helping us out. And the campaign is a 3-year campaign, so we're into it about 6 months or so. But the 1.1 million is what we're really trying to match right away.
Okay. And how many children do you currently have in your client base?
I probably can't give you a full number right off the top of my head, but we have seen an increase, of course, at the hospital. What's interestingly enough is we actually served fewer children this year than we did last, but that's because we're seeing that the length of stay for children is actually longer. But we did serve more patients, more days in the hospital than we ever have.
And I was going to ask you about your staff. Is there a staffing to patient ratio that you try to maintain there?
I know in our school, and I started to talk about Laurel Hall School, our ratio is about 1 to 3. That's probably about the same at the hospital. Again, it depends on the acuity of the patient. But the important thing about our hospital is the stress of a family. When a family finally realizes that their child needs to be hospitalized, it not only is going to help the children, but we also offer group therapy, family therapy. So it is a family participatory care, and so having to travel is really tough for a family.
And I think one of the nice things about Laurel Hall, because it does partner with WCPS, those kids don't lose time from school, and when their treatment is successful and they go back, they're right back in place.
Our goal is to get a child back into the public school.
That's terrific. Well, I'm grateful for Kay for sharing Brook Lane's story with us, and for you, our viewing audience, for joining us on Reach Out. Every community needs to provide care for those with emotional and behavioral needs. In doing so, we express our compassion and we strengthen our community. There are many ways to volunteer, as there are those interested in service. If you or someone you know has received help and or support from Brook Lane, won't you consider helping and supporting their building campaign so that they can better meet the needs of our children? Visit vwcmd.org and make a difference today. See you next time.